I work from 8 in the morning, and I usually start by looking at all the medicines query prescription requests that come through. Then I would look at any things that come through my tray, so documents that patients bring in my tray. Any telephone calls, I tend to do those from about 10 o'clock. I see patients in between if somebody comes down to the front desk. I also, sort of take a special role, so my role isn't just about medicines. There are clinical elements to it as well. So even though I'm talking about, say, warfarin or anticoagulants for atrial fibrillation, I'm also looking at the condition itself and how that's being managed for a patient in conjunction with the rest of the practice. Same thing with diabetes or respiratory problems. I think it's because I'm available all the time. I'm here. So if patients want a question answered, I'm immediately available to see them or to speak to them. So I can take any time from a few seconds to half an hour if needed. So I think patients really appreciate that. They've said to me more than once, it's so nice to be able to speak to somebody immediately when the problem's there, rather than having to make an appointment to come back. Because you're employed by the practice, enables real positive change within the practice, whereby it's a you're fully part of the team. You're influencing the way prescribing, the quality of prescribing. I deal with between 60 and 100 patients a day in various ways. I value speaking to them. I really think they gain a lot from having time to have a conversation about medication. I enjoy feeling that we, as a practice, I'm part of a team, it's not just me, that as a practice that we prescribe to the best of our ability, both in quality and safety.